join us on Likeable Science here on ThinkTech Hawaii, broadcasting from the ThinkTech studios in Pioneer Plaza. I'm your host, Ethan Allen, and Likeable Science is all about making science fun, accessible, helping people understand that science is a vibrant and vital part of everyone's life and all of our daily activities. To help me explore that today, I have with me Dr. Brian Walsh, who is a president of Feather and Fur Veterinary Clinic. Welcome, Brian.
Thank you.
Good to have you here. Brian is as I said, he's a veterinarian. He went through an interesting educational program where he did a 7-year process, undergraduate and graduate work at Worcester Polytechnic Institute in Massachusetts and Tufts School of Veterinary Medicine. He started Feather and Fur in 2000, became a part owner in 2010, and now, as of last year, is the president of the group and running an amazing clinic there. A little disclaimer: I've worked with Brian. He's helped our cockatoos on several occasions and seen them through some tough times. So how did you get sort of started? What was it that drew you to veterinary medicine?
So growing up, I always liked science. I always just liked trying to figure out how does the world work and understand how everything works. And so basically stemming out of that, science was always a draw to me, and then biology and medicine also were very interesting to me. And so veterinary medicine was one of those kind of things that was always, ever since I was like 8 years old, I always remembered wanting to be a veterinarian. And I just loved working with animals and science and medicine, and it all just kind of connected.
Oh, excellent, excellent. I occasionally had dreams of being a veterinarian, but the veterinary school process sort of scared me off once I realized how tough it was.
Yeah.
But so you've been a vet in a very interesting time in terms of sort of the technological developments, right?
Yeah.
I mean, things have changed a great deal since when you sort of got into the field and started practicing.
Yep.
And can you tell us a little bit about how some of the technological shifts that you've seen?
Sure. Yeah, I mean, technology affects pretty much like every aspect of everything I do. So we've had developments in terms of like equipment we have for diagnostic potential, equipment we use for monitoring patient care, equipment we have for keeping patients comfortable. Even things as like the vaccines, we use vaccines as an old technology, but they use modern biotechnology, recombinant DNA technology to create new vaccines and stuff like that. So just every part of veterinary medicine is affected by technology for sure.
Excellent. So what do you think is sort of the biggest or most exciting piece of this to your way of thinking?
So, well, I mean, in terms of the overall concept, we're able to provide better care, faster care, more accurate care, more efficient care to all our patients, and so that's why I love what technology brings. In terms of just like a single device that's changed how we practice, what made probably the biggest difference is our X-ray machine. So old X-rays would be the X-ray machine shoots the beam down, it goes onto film. The technicians then take the film, they go into the dark room, they process that, and then 7 minutes later they come out with the film. We see what it looks like. Sometimes it's okay, sometimes we have to reshoot it, and the whole process takes a long time. Now with digital X-rays, we basically can take just like taking a picture. So we put the patient on the table, hit the button, within 5 seconds, we have the image up on the monitor. We can see everything we need to see. If we need to reshoot a different angle, we can reshoot it. And it also does more detailed, more precise imaging, so the detail is better, we can zoom in better, and then we can also immediately transfer it to specialists who can then automatically review it for us, and so we can get more comprehensive care.
So every aspect of the work is really influenced from sort of the first time you see the patient to sending out the records, as it were.
Yeah.
Excellent.
So before, like the whole process of like taking an X-ray, getting it reviewed could take several, like the X-ray we could still get in 15 to 30 minutes, get an X-ray set, but then getting it reviewed would take another couple of days to get the images back and hear it back.
Sure.
And now we can get everything done in minutes. And so it just totally changed everything. And essentially the machines are expensive. They're almost like, they're a little over $100,000 to buy it, but it essentially saves so much time. It's almost like an additional employee that we don't have to have just by having that technology.
Right, because you save days of time. You can you can be much more responsive in your care, basically, then to an animal.
Yeah.
That's super. And so these technologies let you do sort of more things do things better,
Yeah.
do things quicker.
Yeah, so we can do it quicker, we can do more x-rays in a shorter amount of time, so we can get more images on something to see more of what's going on. But it's not just x-rays, I mean, like so much of everything we do has gotten faster and gotten better. You know, so even we have blood machines in our house, so in the hospital, so when a patient comes in, we draw blood, we can get their kidney values, liver values, white blood cell count, all the things we need to see how sick they are within 15 to 30 minutes, where before it used to have to go to a lab on the mainland and come back. And so now we can all have fast, accurate results on what's going on with our patients in that regard too.
Wow, so that's again, it's a huge step up in terms of improving the care for the animals.
Yeah.
That's super. So this is all, it's sort of amazing to think how this must be forcing you to always be learning new stuff too. I mean, you and your staff have to constantly be learning.
Right, yeah.
So it probably keeps you on your toes, as it were.
Definitely, yeah, and that's one thing, like we have, all our doctors go to the mainland for continued education, which Hawaii didn't used to require, but our hospital always used to make sure all our doctors would go for at least 30, 40 hours a year. And you know, so we keep up with current things there, and then also we're all members of an online veterinary community, and that's also something else that's really revolutionized how we can research problems for our patients. So there's an online community of veterinarians that are like board certified cardiologists, board certified dermatologists, board certified ophthalmologists, and so if we have weird questions, especially being way out here in Hawaii, where there's not a lot of board certified specialists, we can read through previous discussions on cases that fit ours or ask questions specifically about what we have going on. And so that's another way that's allowed us to keep all our doctors current on what's going on. So whenever we have even a case that we've always been treating a disease we think we know well, we can always read what do the current specialists think on that case, so we can stay on top of where the current thoughts are.
Yeah, no, that's great. With an electronic community like that, you get the advantage of many people being able to, you could send an X-ray out, for instance, and get different opinions on what it might be showing. And
and even just like I used to post earlier, like I'd say I have this case with this and this going on, but as I looked at it, there's like so many other people that are now part of this community because it's been growing and growing, that I don't even have to ask about. All I have to do is just describe my case, and like a bunch of other people have had it, you know, and then I can see what they did and what their results were, and then I can use that to gauge how I treat my patient.
That's super. That really, then you get this benefit of sort of many minds working on the same problem.
Exactly.
So, and I assume, of course, you reciprocate, right? You comment on, and if you see stuff coming up that you think...
For the weird things, because we're not specialists, so I don't want to like step on specialist toes, but for the weirder things that not a lot of people have seen that we have seen, or funny things in Hawaii that we see more often, sometimes we'll comment on that.
Well, you were speaking of weird things, you were talking earlier a little bit about some of the odd animals that you've treated.
Yeah.
Could you...
Sure. So, you know, so part of in veterinary medicine, some people will specialize in large animals, some people specialize in small animals, but some people do the exotics. When I was in vet school, I didn't know what I wanted to do. I just loved everything about the field, and so I did rotations through everything. And so I did rotations at a Franklin Park Zoo in Massachusetts, and I did a rotation in Uganda with their vet school there as well. And then at Feather and Fur, we are one of the bigger bird hospitals on the island, and so we'll get birds brought in from Sealy Park, the Department of Land and Natural Resources, that will fix broken wings and other things. So I've worked with here, most recently penguins, also red-footed boobies, blue-footed boobies, terns, Hawaiian stilts, pueos, so a bunch of the native birds we've done work with. And then from just going further back in vet school, I worked with camels, I worked with bears, I worked with lions, Cape buffalo, wallabies, kangaroos, all sorts of interesting things. Giraffes.
And looking back, of course, you can now see if you had some of the tools you have today, you probably could have done some of that work faster, better.
Yeah.
Neither, you might have made different choices, actually, right, based on...
Exactly, yeah.
But of course, you only have the tools you have at any given moment.
Right, yeah, and for the really big guys, they still don't have the tools designed for doing the really huge animals, but for all the smaller guys, certainly.
Right, yeah, they probably don't make many operating cables for elephants. You know?
Right, exactly.
Those are hard. So, these technological advances, sort of, how do you think these develop? What's sort of driving them?
So the biggest thing, it's need. You know, so there's, you know, like we wanted to be able to get blood results faster, so they developed the machine, so instead of having to send it off, you know, we have it in the hospital. Our patients, for monitoring, as we've gotten better with understanding anesthesia and monitoring anesthesia, they've developed better technology for monitoring the patients under anesthesia. So basically, it's just like the need for those things helps create the drive for it, and with the anesthetic monitors, another thing that I hadn't talked about yet, but basically we have a little box that's about this big that we hang on our operating room table, and then it has these little probes, one that goes into the patient and does an EKG and a temperature, another one that goes a little cuff around the wrist that gives us their blood pressure, and then we have another one that attaches where they're breathing in that gives us their end-tidal CO2 for measuring their carbon dioxide levels within their body, as well as their oxygen saturation. And so we can have all those that are then connect to a Bluetooth computer, and it's all up on a monitor in the background in the operating room, so we can see what our patient's heart rate is, what his blood pressure is, what his temperature is, so we can monitor all these vital parameters. Back years ago, you just had a technician that would have to go and do each of those different things, and going back even further, they weren't even monitored. Maybe they just did a heart rate at best, and so that's one area where the need to do closer anesthetic monitoring has developed the technologies to do it, and then that allows us to do longer procedures safer with fewer complications.
I see, and presumably is paralleled in advances in human
medicine,
right?
Exactly,
they
so
monitor more things for us more closely all the time.
Exactly, yeah. So a lot of veterinary medicine is borrowed from human medicine. So, as they're developing new technologies, new parameters to watch for, our people are also learning that. Veterinary medicine is also doing its own independent stuff as well, and then incorporating it in their kind of stuff.
Excellent, excellent. This is a fascinating conversation. We're going to have to take a short break here. I'm Ethan Allen, host of Likeable Science. I'm here with Dr. Brian Walsh, and we're talking about veterinary medicine and technology. We'll be right back.
Aloha, welcome to ThinkTech Hawaii. My name is Josh Green. I'm the host of a program called Healthcare in Hawaii. I'm a physician. I work in the emergency department on the Big Island. I also serve in the state senate, which, please don't hold that against me, doesn't detract from my television program. We speak about all the big healthcare issues in the state. We get together on Tuesdays from 2 o'clock till 3 o'clock in the afternoon, and we try to talk about the most important issues in healthcare. This is a terrific venue for people to learn about healthcare. There are many programs on this station. We broadcast it later, not just on the internet, but also on OC16. Thanks for joining us. Please be informed healthcare consumers.
And you're back with us on Likeable Science here on ThinkTech Hawaii. I'm your host, Ethan Allen. With me today in the ThinkTech studios is Dr. Brian Walsh from Feather and Fur, the president of that group, and we're talking about veterinary medicine and technology and how technology is changing the field here. So we were talking earlier about some of the upsides, the way technology can make your life easier, get you results faster, more accurate, more thorough care. Are there downsides to this technology?
Not a lot, really. Every technology thing that we've incorporated has its own drawbacks. Like our anesthetic monitor that I love so much. For the really small patients, it doesn't always work quite perfectly, and so then we'll have a secondary device that we use to monitor them. So not everything is just totally perfect, but there's nothing where I'm like, oh, this has made things worse, or this is a big drawback. The other thing, another kind of technology thing, although it's not directly patient care, is all our records are now computerized, and so that's saved tons of time in terms of being able to find old records, find where things are, and and being able to read it, because back when everything was written, it was much harder to read and that kind of stuff. So the record keeping is better, but then computers will crash, computers will run slow, and then when that happens, then we're all scrambling to reboot the system and figure out the new stuff to get that. So there's the hiccups that you get with technology, but overall I'm much happier having the technology than not.
And I know in medicine, sometimes some of the medical advances raise sort of ethical questions, but I don't know if this would be the case in veterinary medicine so much.
Yeah, so there's some of it in terms of the biggest area probably would be how far do we go with keeping a patient alive now,
right?
And so our technology is to a point where we can keep these guys going for quite a while. It's similar, not as advanced as human medicine, but certainly way more advanced than it used to be. And so you can keep these guys that are critically ill going to kind of try and give them more time to recover. But then the question goes, how much time do you give them, especially when they're in such a critical state, and they're suffering? Do you really just keep going? And there's an ethical dilemma of, what are you doing to that specific patient? And then unfortunately, veterinary medicine, we also have to consider finances too,
Right.
you know, and how much of the owner's money are we spending to keep this patient going with an uncertain outcome.
Right,
you
right.
know? And so that's kind of a dilemma we face on a regular basis.
Yeah, very, very interesting. And your technology has actually pushed that one to the forefront, probably to
Yeah.
some extent.
Yeah.
You're able to save patients who would have died quickly otherwise.
Right. Yeah,
but
because
what are you saving them for, in some sense? You know?
Right, yeah, because we're able to get the blood work faster, because we're able to do the imaging faster, we can react and respond appropriately more quickly, you know, so we can get these guys turned around. But not every problem is fixable, you know, and so sometimes we can just temporarily stabilize it, you know, and then we have to decide, once we figure out what's truly going on, have an honest discussion with the clients and give them all the variables and come to a team decision on what's best for that specific patient with these specific parameters.
Right, yeah. So that is truly, I guess, some ethical dilemmas and moral questions you face there.
Yeah.
So that's intriguing. So this really runs the gamut, then, it seems to me. You spoke of everything from record keeping to diagnostics to sort of long-term care.
Yeah.
I mean, is there any area that really hasn't been impacted by technology?
I mean, not that I can think of.
It helps you in observation.
Yeah, because even things that I haven't specifically talked about yet are, so we have diagnostics, we have record keeping, but also just patient monitoring and understanding anesthesia we covered, but also just the direct patient care. So we have like devices to keep patients warm, so we have special tables that are heated for them. We have special warm air blowers that can heat them up. We have special incubators for our exotic species and stuff that can keep them warm and keep them humid. We've got an oxygen concentrator that takes room air and it makes it 95% oxygen and then pumps out oxygen, so we can run oxygen cages and do high oxygen environments for our sick patients and stuff too.
Wonderful.
And so just the level of care we're able to give them has just improved. As well, and things like the oxygen concentrator is a huge saving, because buying oxygen in the big gas canisters, which we still have to do, is extremely expensive. And by buying this little portable oxygen canister, oxygen generator, oxygen concentrator, it's cut our oxygen bills in half. And so it's a better savings to the patient, because we can do faster oxygen delivery around the clock, where we don't have to worry about the tanks running out, the draining the tank. So it's cheaper, which then allows more people to utilize it, or more patients to utilize it.
Super. No, that's true. I hadn't heard of that technology. An oxygen concentrator.
Yeah, so like they use them for, like, it comes down from people, so you have like people with emphysema and stuff like that. So instead of having to carry an oxygen tank around, now they make these little like oxygen concentrators and stuff. And so now we just have like a veterinary hospital scaled big one that can do like about half of our hospital.
Okay, great. And so, can you maybe walk us through how a case, if you had, say, a sick parrot come on in 10 years ago versus coming in now, how that sort of how it look different?
Sure. Yeah. So 10 years ago, when we have a sick parrot come in, basically the biggest thing is more like the speed of diagnostics. So we'll still look at them, and with birds they're a lot more complex than like the cats and dogs, because if you do too much to them, they're much more likely to pass away. And so that's one area where having the fast x-ray makes a huge difference, where we can get the x-ray more quickly. Having the incubators we have had for for over 10 years, but that was something that maybe 20 years ago wasn't as commonplace. And having those increases their survival by keeping them warm, keeping them humid, that kind of stuff. And then being able to get the blood results back faster, definitely improves that. Although sometimes with really sick birds, we can't always draw the blood, because it can be too much of a stress. Or if they're only like 25 grams, we're probably not going to take a lot of blood from them because they can't spare it.
Yeah, exactly. I know it's always.
Yeah, but for the cats and dogs, it's probably improved even more dramatically because of the ability to get the rapid blood results, the ability to do the x-rays. We also have an ultrasound, which is another thing I haven't discussed yet. And the technology of ultrasounds improved really greatly, so we can do a much faster job of finding abdominal tumors, or finding heart issues, or finding fluid filling up in the belly, or in the abdomen or the chest with the ultrasound. And like 10, 15 years ago, those weren't commonplace in veterinary hospitals, and now they're becoming more and more commonplace as the technology has made them cheaper and smaller. So instead of being $250,000, you can get them for $15,000 to $30,000 and still get a decent system.
Excellent, excellent. But then, of course, you need to spend time and energy with your staff, getting them trained to use
Right.
it well, to interpret the results correctly.
Right, yeah. And ultrasound is something in particular where it's kind of weird. If you haven't seen one before, it looks like a bunch of gray static to people that aren't used to using
Right.
them. And that's one where definitely it takes a lot of experience and just hands-on practice with them to figure them out. And so all the doctors in my hospital are pretty good at finding abdominal bleeding, like large tumors, fluid in the chest, bladder stones, the basic kind of things. But then we have a board-certified specialist now who is on the island who has a really high-end machine, and that's all he does is x-rays, and he's the one who reviews the x-rays that automatically get sent from our machine. He's got a high-end ultrasound machine, and he'll come to all the different hospitals. He comes to our hospital because we're big and busy a couple times a week, and we'll scan anywhere from like 2 to 6 patients, and his is a much more thorough, more in-depth scanning, and then that allows us to get even more detailed information on what's going on with our patients so we can treat them more quickly. And years ago, those guys weren't as prevalent, so there was one who would come from California, but he would only come, every month or every couple months. And so when you had an urgent case, it was a lot tougher. But now we've got that technology within, much more quickly, within a day, if not the same day.
That's intriguing to see how and it's really changed that every aspect of the entry and exit. And I mean, I suspect you must then get sort of higher success in some sense.
Right, because we know much more quickly this guy has a bleeding splenic tumor, he needs to go to surgery now, and we can get it done, and then we also, and another thing that's been around for a while but is more developed, are we have like blood banks for dogs. And so we have like blood that we store at our hospital for doing transfusions and stuff like that, where smaller hospitals and older places, like they didn't have, that access to that technology.
So do dogs have different blood types?
There are, yeah. So there's 2 main types. There's what's called DEA dog, erythrocyte antigen 1.1, and then there's positive and negative dogs. And you can give negative blood to a positive dog without any problem. Positive blood you can give to a negative dog once, but the second time you do it, you're likely to have a fatal transfusion reaction. So we used to have, my own dog is a negative dog, and so we used to use him as just a donor when we'd have the emergencies, and we'd just call him in, and someone would go pick him up and bring him over, and he'd donate, and then he'd go home. But because we got so busy, we needed the blood bank, and so now we have just bags that are ready to go of the 1.1 negative blood just stored up.
That's intriguing, sort of like the old saying about you don't need a parachute to skydive, you just need a parachute to skydive twice.
Right.
sort of the same deal.
Yeah, exactly. Yeah.
Super. So when I guess my question is, how do you know what, sort of when to use what?
Okay. Yeah, so when a first patient comes in, we do 2 things. One is we get a history to figure out what's been going on further back. Did this just happen suddenly? Was it recently noticed? Has there been stuff going on for a while? And so we'll look at things like, have they been drinking more? Have they been urinating more? Have they been vomiting, diarrhea, coughing, hard time breathing? All those kind of things. And this is just like old school basic medicine. That's what you do. And then that kind of puts you thinking on certain things, and then we just do a real thorough medical exam, which is, again, like old school, not new technology, but basically feeling the patient closely, checking their gums, feeling their abdomen, listening, all those things to try and figure out what we think is wrong. And then once we combine those things, we have usually a pretty good idea of what could be going on, or at least where to start. And so if it's something non-specific, then usually blood work, and then possibly ultrasound or x-rays, depending on what else is going on. If we know there's a specific respiratory issue, then it's right to x-ray. If the patient's unstable, then we do things to stabilize them first and then figure it out more closely. So we give them IV fluids right away and check their blood pressure, which is another technology that's more and more present too, is we have both the anesthetic monitoring device that can check blood pressure, but we also have these, what are called these Doppler Parks units, which are these little devices that are about this big, and then they use Doppler technology to listen to the blood vessels. And so you put the probe over the artery, and then you hear a ch-ch-ch sound for the heart, and then you can use little cuffs that go with that to figure out their blood pressure. And so that's something that's done commonplace in our hospital, but 15 years ago wasn't that common in veterinary medicine. And so basically we do what we need to based on their signs running the tests, we think, based on what they're doing.
So this is really, I mean, it really sounds like very much now veterinary medicine in many senses is right at the same level as human medicine
In a lot of ways,
levels, whereas
yeah.
it used to be much less sophisticated.
Yeah,
But-
so
but-
yeah, we even do, like, not at our hospital, but there's another hospital in town, the Veterinary Emergency Referral Center, that can do CT scans, and then they also have the equipment so they can go over to a human hospital and use their MRI in the middle of the night when no one's using it. And so we've sent patients over for MRIs and CT scans. We've sent a rabbit over for a CT scan. I personally used to take animals we used to have to go to co-OL radiology over at Queens with our dogs and birds and stuff and CT scan them there, but now the other hospital just has one there, so it's, again, that's another improvement in patient care technology, that the machines have become affordable so that veterinarians can now own them and run them. Not every veterinarian, but at least the specialty centers can now have them.
Sure. So that's absolutely stunning that we have that level that people will invest in getting a CT scan for a rabbit.
Yeah.
That can't be a cheap procedure.
No, it's not. Yeah, yeah. So yeah, for people that are really love their pet and have the means.
Right.
You know, I wish we could do it for everyone that needs one, but that's another. When you're asking about ethical issues, that's not a technology issue, but it's just a dilemma we face all the time. Is when there's a patient that needs care and the funds aren't there, what do you do?
Right.
You know, and so that's something where we always just have to do our best to kind of compromise where we can and try and get the patient the care it needs as best as available.
Yeah, yeah. I'm sure that must pop up at times if your animal's been brought in sort of off the street or whatever, and you have no knowledge of any background or who's going to take care of them.
Right, yeah, and we've gotten strays from the police or other people have just dropped them off, and then we basically do what we can to try and find the owners and try and stabilize them, but it's definitely it's a difficult situation because, again, you don't know how far to go, what's the full story, you know, and all that kind of stuff.
Right. So this is great. Thank you very much. We're going to take a short break here. You've been watching Likeable Science here with Dr. Brian Walsh and me, Ethan Allen, talking about veterinary medicine and technology and how technology is changing veterinary medicine. We're going to take a short break and then we'll be back.
Aloha. My name is David Day. I host ThinkTech Asia, and we talk about international business, foreign policy, geopolitics, and we broadcast live every Thursday afternoon at 4 o'clock and on Alelo 54. Make sure you tune in, and we'll see you there.
Hey, and you're back on Likeable Science. I'm your host, Ethan Allen, broadcasting here from the ThinkTech studios, Pioneer Plaza. Today we have with us in the studio Dr. Brian Walsh of Feather and Fur, and we're talking about how technology is advancing veterinary medicine and all the interesting interplay with the technology in sort of larger sphere of medical treatment too. And so have there been cases where sort of advances, technologies have been used with animals and that's helped really advance human medicine?
Yeah, those cases do exist.
Okay.
I just can't think of them exactly off the top of my head, but there are cases where veterinary technology does get sent back up to human stuff, and they use stuff we learned. Even things like vet wrap, which is like the stuff that people get on their bandages all the time. It's like this stuff that sticks to itself. That was originally designed as something for animals because of the hair, and so we basically kind of wrap it around. But now my wife, when she had her bandage, she had essentially what we would call vet wrap, but they don't call it vet wrap at the human hospitals, but that's what it was originally. So that kind of technology is used. So she just had a boring collar when she had to get her bandage changed, so I put our vet wrap that had little dog bones on it for when she went back for her recheck. So
there we
they
go.
found that amusing. And then the other, and just in terms of like research too, a lot of the stuff that was done with the HIV virus, the type of virus that it was, that family of virus, was similar to the FIV, feline immunodeficiency virus in veterinary medicine, which was known before HIV, and so a lot of the early AIDS research was borrowing information from veterinary medicine as well.
Is this the agent that gets feline leukemia?
So yeah, so feline leukemia is one virus, and then feline immunodeficiency is another virus. So they're two different viruses that are common in cats that we have like a little snap test for, so we just can screen them for.
Okay, excellent. So where do you see all this going, sort of in the future? Sort of looking ahead, what do you see as the sort of the next big thing, and how is this going to really change people's pets' lives?
Yeah, so that's a good question. There's a lot of stuff that's up and coming, and so there's new new chemotherapy drugs that are being developed for animals that are showing a lot of promise. There's stem cell technology, which is being used in humans. It's also being used in veterinary medicine as well. There's a company that we were working with a little bit too, actually, that has made their own stem cell harvesting machine. So we would collect the fat from an animal, from one of our patients, put it into their machine. It would process out the stem cells, and you can use those to inject back into arthritic joints to try and get, like, it has anti-inflammatory properties and some other healing properties, we hope. And so there's a lot of research being done with what can stem cells do. And then even just things as simple as the laboratory tests we do, they've developed PCR technology for doing DNA sequencing of organisms, so for infectious diseases. So we used to screen for tick diseases. We'd have to send out these blood titers, and then those would take like a week to come back. Now they've got these PCR tests where we can screen a whole bunch of diseases super fast and super cheap. And so that's made our ability to diagnose more quickly. So there's, you know, new drugs, there's new diagnostic tests that are making things more efficient. You know, ultrasounds are getting better. You know, so all those things are just making it so much more fun and easy to practice medicine compared to where we were 15, 10 years ago without, you know, all those things.
Okay. And so you'll be able then essentially to probably treat problems that just as you can now treat problems you couldn't treat 10 years ago, probably 10 years from now you'll be able to treat problems that today are basically intractable.
Right.
You may be able to deal with more advanced cases of cancer.
Right. So yeah, we can. Yeah. So cancer is definitely one where we don't have cures for a lot of the more systemic ones. With ones that we can, there are a lot that we can cure with surgery, but the ones that we can't, that need chemotherapy, those basically we can buy quality of time, you know, buy length of life, but can't cure. But there's new things coming out that will allow us to go treat longer, make them better. There's cancers that were less responsive that maybe have something that becomes more responsive, and just finding like the infectious diseases, if we can figure out what exact disease we're dealing with more quickly, then we can get on the right drug more quickly, you know. And so, and a lot of that too, as things get cheaper and faster, then it's more likely that we can utilize it, because some stuff is cost prohibitive in veterinary medicine, and so if the technology isn't cheap enough, we can't use it widespread. So as things get cheaper, it gets more utilized.
Right. You know, I mean, we see, of course, there's the same problem in human.
Right.
You know, they'll develop a drug, but it costs $100,000 for a treatment, and you can't provide it to everyone then. So same kind of issues.
Yep.
And so this ultimately then will should result in a healthier pet population, right?
Right. Yeah. So patients are actually, pets are living longer than they used to, and a lot of that is better nutrition, better veterinary care, better dental care. You know, which is another area where technology has advanced. Before, like, veterinarians used to just kind of clean the tartar off the teeth, but now we do dental x-rays all the time. We do more in-depth periodontal disease, more periodontal restorative work, and just keeping the teeth cleaner keeps the animal healthier, because there's all this less bacteria, less pain in the mouth. And there's some veterinarians that will even do root canals and stuff like that as well. So.
It's completely the parallels to medicine, and now you're saying dentistry are astounding here. That's just amazing. They will actually run that kind of run that kind of thing. So, but to get back to, I guess, an issue we talked about a little bit earlier. So there's sort of the haves and the have-nots here, right? I mean, some of these technologies are very expensive to run, and if, for instance, bring in, say, a tern that's been, you know, brought in and found on a beach somewhere, you can only do certain things for it, and you know.
Yeah. So it depends on the given situation. So like unfortunately, like the native species get preferential treatment over the non-native species.
Oh, interesting.
And so but the other issue for the native species is the goal is, for the most part, they need to be releasable.
Right.
You know, and so if they've got a bad wing fracture, if I can fix it and it not have any long-term issues with flight, then it's going to be releasable. If it's really mangled, then we have to look to see if there's any kind of like educational facility that could use a one-wing guy, or if he's got to go to heaven.
Right.
You know, and so with those guys, that's one thing. With people's pets is, you know, another thing too, of where we basically, if we can't do everything we want, we just do our best guessing without all the data, and get as much as we can done for that patient for as little as we can.
Sure. Yeah. You got to I guess play it by ear in that sense. So what do you think is going to be the next big advance? Do you have a sense about what's going to change the most in medicine?
That's a good question. I think probably the stem cell thing has the most potential.
That sounded very...
Yeah, so it's the research that's being done with that has been showing like a lot of potential to get things to heal that they didn't think were going to get to heal, like nervous conditions and like eye conditions and other kinds of degenerative conditions. And so I think that's going to be the next biggest.
It seems like that could be one that feeds back into human medicine too.
Yeah.
If they show that it can actually work in animals, people are going to be more likely to want to try it on themselves. So
Right.
that could have a very synergistic impact on human medicine.
Yeah, absolutely. Yeah, they're researching both lines right now. Both human and animals are.
Right.
They're doing all sorts of stem cell work, and that has a lot of interesting potential. It's still in its research phase. It still has a ways to go in terms of knowing exactly everything it can do, but it definitely has a lot of interesting potential.
Yeah, because if you can get your own cells back to a sort of a
Right.
primordial state, you
Yeah.
can start fixing a lot of stuff that's really gone very, very, very badly wrong. Right?
Correct. Yeah, and then not have to worry about any type of
Right.
rejection from different tissue types or something like that if you're doing any kind of transplant or any of that kind of
Yeah.
stuff.
Huh.
Yeah.
That sounds like that's gonna really shake the world up.
Yeah.
But on the other hand, it sounds like there's a real part of veterinary medicine that's very sort of constant. That is, as you talked about earlier, a patient comes in, you need to get a thorough history, and then you need to do a very thorough
Yeah.
personal exam, basically.
Yeah, the basics of medicine are still the basics,
Right.
and you can't just jump right to the MRI without
Right.
thoroughly evaluating the whole history of the
You
patient.
don't have your tricorder. You can just
Exactly.
point to them and say,
Yeah, when they develop those, I will definitely want to get one.
yeah, those would be a useful tool for sure. I mean, some of this that you're talking about sounds like it's actually coming close on certain levels.
Certain levels, yeah.
You know, I mean, the ability to take blood now and get it screened for multiple agents and multiple problems and get
Yep.
the results back in a few moments
Yeah.
I mean, yeah, 30 years ago you wouldn't have thought that was even something to dream about, right?
Right, exactly.
Yeah. Excellent. Well, that's just super. This is so. Do you what I guess what do you find most exciting here about this whole business?
Well, I love to care for my patients. I love to fix problems, you know, and so what I find most exciting is to be able to do it so much more quickly, so much more efficiently, for less money, faster time, more success rate. You know, all those kind of things come together, and technology allows me to do all of that. And so that's really where it all comes together for me, is providing better care for my patients.
Yeah, I can see it. There must be a real satisfaction in seeing a patient that 10 years ago it would have been a long, hard struggle with very questionable outcome, and now today it's like bang, 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 and they're out the door healthy.
Exactly.
So that must give you a real sense of, wow, this is being good.
Yeah.
Excellent.
Sure.
Excellent. That's got to be a very, very rewarding aspect to your work, I guess.
For sure. Yeah.
So how do you how do you sort of keep up with all this stuff? I mean, it must be a very tricky business to think about what training you get for who, how, when.
Yeah. So as our hospital's gotten bigger and bigger, some of our guys, like, we let them just kind of pursue their interest. So if someone has more of an interest in surgery, then they can be the one that does more of the advanced surgery research and that kind of stuff. If we've got someone that's more interested in chemotherapy or the exotic species, then we kind of let them kind of research things out too. And then like that online website, that online veterinary community that we're a part of, I mean, that's a great thing for helping us keep current, and then just all the continuing education we all do on a regular basis.
So this continuing education, these are like courses that you go and...
Yeah, so it's like, so there's conferences that are like anywhere from like 3 to 5 days, where it's all the cutting edge thoughts on avian care, or the cutting edge thoughts on emergency and critical care, or the cutting edge thoughts on just like veterinary medicine in general. And then there's like little sub lectures that you pick and choose. I want to see the cardiology one, or I want to see the kidney one, or that kind of stuff. Okay. And so it's all those kind of conferences and stuff like that.
Excellent. So you just have to really, it's sort of, again, it's a multi-pronged approach to stay in touch and stay on top of these things.
Exactly.
Excellent. But it sounds like there's tremendous payoff to it in the sense of you've got a practice that's moving along, it's really staying up right at cutting edge levels here and constantly growing and improving.
Yeah, yeah, and it's fun for us to be able to provide like the level of care that we can, where like 10 years ago or 15 years ago when I first started the practice 14 years ago, we weren't as big, we didn't have the 24-hour care, we didn't have so many things that we have now, and just the level of care we can provide now is just so much better than the level of care it was then. I mean, I always thought we were good, but it's just been nice to stay current and move as things have advanced to stay up with that.
Yeah, I know. That's one of the things that you guys do is this 24-hour business that's really, I think for a lot of pet owners, that's a real reassurance or relief just to know that's there, basically. It's like, I may never use it, but it's nice to know if I suddenly, at 2 in the morning, my pet needs something,
we'll be there.
You know, there's a veterinarian that you can go to, and
so there's just a few hospitals on the island that do that. We're the only ones on the windward side. And it's definitely been like a staffing and logistical challenge.
Sure.
But we've been happy that we've done it because just again, like I said, like my goal is highest level of care for my patients, and that's helped us do it. You know, so I know my patients have a doctor there around the clock if their status changes.
Yeah. Okay. Right. If that is the ones who are staying there.
Right. For the ones that are staying there.
For
as well as for if our clients have a problem and need to come in, we're available for that.
Okay. Now that must be. The people who are there during the night, during the slow period, must. Then they do get a chance to.
They may argue that that's the slow period. So the guys that are there at night are pretty busy too.
Well, because that's the time then they can actually sort of focus in on the patients who are there.
Yeah, and then the ones that come in at night are usually the most critical. You know, if someone's coming in at 1 in the morning, they probably really have a problem if the owners are going to bring them in.
Yeah, that's true.
And so we're pretty much busy from 7 a.m. until about 3 or 4 a.m. And even some days it's been getting where we're almost busy till 5, or like sometimes we're just busy straight 24/7. Yeah.
Okay, well, it's great that you're here, that you have this wonderful caring, this wonderful technology to support your caring attitude. So it's been a great conversation, very stimulating, thought-provoking, to see all these parallels between what it is you're doing and what's happening in human medicine. And I really appreciate your being here. Thank you very much.
Thanks for having me.
I'm your host, Ethan Allen. I've been talking with Dr. Brian Walsh from Feather and Fur, and we've been discussing veterinary technology and medicine and how this is all advancing and changing the way we all take care of our pets. I will be back next week. Until then, have a good week.